I am so pleased to introduce Amy Wilson-Stronks, who is joining us now. Hi, Amy.
Hi, Sarah.
Amy is currently an independent consultant, researcher, and advocate. Prior to starting her own firm, she served as the project director for health disparities work at the Joint Commission.
Thank you so much, Sarah. I'm really happy to be here to be able to share some information and some resources that will be hopefully useful to our audience. I'm happy to say that patient-provider communication has really found itself much higher on the national agenda. And much of that is because we've recognized and better understood the very strong link between communication and patient safety. But patient-provider communication is a very, very complex phenomenon because there's so many different vulnerabilities that both patients and providers can bring to an encounter. There are so many different players that are involved in healthcare. So when a patient enters the healthcare system, they're interacting with multiple players, and that presents many, many different points for potential misunderstanding. So when we think about what we want to do in order to promote patient-provider communication as a patient safety imperative, we really need to look at it as a shared responsibility. And that responsibility spans our systems, as well as falls upon individual behavior and the ability for individuals to really modify how they're thinking about patient communication and thinking and acting in the best way to communicate effectively. So some of the foundational research that really has formed my understanding of these issues is work that I was fortunate to lead when I was at the Joint Commission. And that's a study funded by the California Endowment called Hospitals, Language, and Culture, a Snapshot of the Nation. And this slide shows a couple of the reports that came out from that study. And I'd certainly urge audiences to look at the reports. They're available for free on the Joint Commission website. This work was really spurred by the recognition that racial and ethnic healthcare disparities exist. And we wanted to understand how hospitals across the country were addressing the challenges that they were experiencing in providing care to an increasingly diverse patient population. So we took this opportunity to actually visit 60 hospitals across the country and find out what those challenges were, and more importantly, find out what they were doing to address those challenges and identify some of the practices that were really important in helping support care to diverse populations. But what was interesting is, while this was focused on patients who were diverse by the nature of their race, ethnicity, and language, we found that the underlying common theme that impacted their care really had to do with their ability to communicate and best navigate the healthcare system. So we realized that this is not something that's unique to patients from racial, ethnic, linguistic minority populations, but it's something that can be unique to all patients, or it's not unique, but it's something that is an issue for all patients. And during this time, I was fortunate to be able to collaborate with some great colleagues from across many disciplines. And we came together to really think about this issue of patient-provider communication, and it resulted in a paper that was published in the September issue of the Journal of Nursing Administration. And this is a call to action to improve patient-provider communication. We decided that it really is something that needs to be in the forefront of every clinician's mind, as well as in the forefront of our hospital systems when they're thinking about effective practices. So what we propose in this call to action is to improve clinical practice to incorporate a more systematic and methodological approach to patient-provider communication. So much like we at the clinical at the bedside, we think about pain management and think about infection control and such. We also need to think about the patient's ability to communicate and have a two-way conversation. So we need, in order to do that, to optimize the availability of resources that exist. And these include our auxiliary services and specialists that are available within our institutions. In order to do that, we need to make sure that all healthcare professionals are aware of those resources, are aware of how to access those resources, and how to use those resources. And then at an institutional and policy level, we need to have standards that really set these performance expectations so that health providers are motivated to really put patient-provider communication at the front of their mind. But we know at both an individual level and at an organizational level, how we address these issues isn't the same for every institution, just as every patient is not the same. But we do want to think about is who are our patients and how can we help find healthcare that's going to best fit their needs. So this slide depicts several images of patients that represent a variety of issues. So some patients may come to the healthcare encounter with an inability to communicate in English. And oftentimes what we find by default is providers rely on the information provided from family members and sometimes even children, which is really a quite challenging process and can result in some miscommunication. Also, cultural factors can inhibit a patient's ability to understand the medical treatment that is being proposed to them, and also can inhibit the provider's ability to really understand how the patient is understanding his or her care. But beyond just issues that may spur from national origin or language are issues that also impact all of us that could be more of a social nature, such as our economic situation, or our insurance status, or our understanding of how to navigate the healthcare system, particularly when we fall in and out of different insurance pools. And also, we find that some patients are disadvantaged because there is a distrust of the health system, and unfortunately that distrust is real still. And there are many reports of patients, particularly patients who are same-sex partners with families and may be considered non-traditional, who have trouble accessing effectively the healthcare system and face actual discrimination in terms of their ability to receive care. So all of those factors really support the need for having effective communication systems in terms of professional interpreter services, in terms of a cultural understanding and recognition that people come from different places. But even if when we're thinking about this, I think we also need to go beyond just people who may seem potentially different from ourselves and think about people such as our white male physicians who can also end up in the hospital, intubated and unable to speak. So that's something that can fluctuate throughout the care process. And we want to be sure when we're thinking about putting together systems for addressing patient-provider communication that we're thinking collectively about all of these issues, because the system is really identifying that need, whatever that need may be, and finding the appropriate resource. So at an organizational level, we really look at communication as being a four-legged stool. I've modified this slide from the three-legged stool that supports the concept that health literacy, language, and culture impact effective communication, and added the fact that somebody's inability to speak, whether temporarily or permanent, also affects that ability to communicate. And in terms of making it effective, the foundation is really at the organization level, through the organization's culture, its leadership priorities, who the workforce is and how that workforce has been trained and motivated to really support communication. And also, because this is something that is dynamic, it really is important to put communication at the top of our quality improvement priorities so that there's an infrastructure for evaluating our systems and making them better. And reaching out to our community, knowing who our patients are, and knowing the resources that exist in that community to support us. It, again, is a shared responsibility. I am so happy that there are now new standards for hospitals that have come out from the Joint Commission, and I'm really happy to have played a part in that. This is a report from the Joint Commission. It's called a Roadmap for Hospitals. It does a really nice job of walking the reader through the care process from admission through discharge, and identifies many of the broad-ranging communication vulnerabilities and challenges, and resources that exist to address those challenges that can be important for hospitals to be aware of and make use of. It also has several appendices, including an appendix with both current and some of the new Joint Commission standards that are specifically written to address effective communication. Also, because this is not just a standards-related issue, but there are many legal and regulatory supports that impact our need and our desire and should motivate us to address these issues. Those are listed in the appendix, and a very robust resource guide that I think is going to be very, very useful for organizations who want to improve their communication systems. So what does an organization with an effective communication climate or communication system look like? It has assessed its communication climate. I think assessment is vital because an organization needs to know what its resources are and also know what its needs are and what its deficits are so that those can be improved. And in order to improve, there needs to be a plan in place for monitoring the processes and identifying when they're working and when they aren't so that those processes can be improved further. And at the, trickling down to the individual level, an organization needs to make sure that it's provided the resources to its staff and medical staff so that they have those available and that they're trained on how to use them, how to appropriately identify the various communication needs and the various resources that can be used to help support patient-provider communication. And making sure that those staff and medical staff are able to provide feedback is very, very important. And lastly, I think including patient-provider communication as one of the evaluation components for our workforce and for our physicians is another way to really further motivate the healthcare organization to make sure that it's meeting all of its patients' communication needs.
Thank you, Amy. You've really helped us focus on the importance of patient-provider communication and the institutional's role and the individual role and the tremendous impact it can have and will have when it's effective and successful on patient care. You began to show us and tell us about some of the 21st solutions to solving this difficult problem in our country. In the guide, there are many mentions of augmentative communication and assistive technologies as one of the ways and some of the tools that we have available to us and we can use both at the institutional level and then for individual patients. We need to put these things in place, and you've brought that to our attention, as well as the need for collaboration across disciplines, because without that we're not going anywhere. Thanks a lot.